Since the creation of the Geneva Health Forum in 2006 by the Geneva Hospital and Geneva University, we have regularly joined our conferences to debate and discuss about global health, held alongside the World Health Assembly. We warmly thank you for your contribution, participation, and continued interest in the Geneva Health Forum. The topic brings forward reflects the priorities of our partners, the list of our partners here for today, and that is the agenda of the World Health Assembly. This year, we would like to address three important topics for Geneva Health Forum and partners: one on migration and health, one in climate change and health. Both started last year, May 2024, with the small groups, and to continue those discussions. And those two conferences will be held tomorrow. But for the first time, and we are very proud, the Geneva Health Forum and partners would like to introduce a new topic never addressed up to now on nutrition, called Nutrition: The Road to 2030, Building on Success, Facing What Next. Good afternoon and welcome, dear panelists, facilitators, colleagues, humanitarian practitioners, global health students and professionals, ladies and gentlemen, welcome. My name is Valérie. I'm a nutritionist with more than 25 years experience in nutrition settings, mainly with Médecins Sans Frontières and the International Red Cross. I'm very pleased to be with you today and to be your master of ceremony. I imagine you have heard these bizarre accents. It's the French one. I will try my best to be clear, but what I can promise is I'm very fluent on nutrition language we are going to use today. So you can ask me, but why focusing on nutrition today? So despite years of global commitments, malnutrition remains one of the most pressing and complex global health challenges. From undernutrition to obesity, what we call all forms of malnutrition, its impact spans all age groups and all regions in the world. 2025 marks key milestone for international nutrition targets, and its progress remains slow and uneven. That's why Geneva Health Forum and partners felt that it was urgent and timely to open the discussion here in Geneva, to take stock of what has worked, to understand what the gaps are, to reflect together on what Geneva Global Health Community can contribute to what's come next. Back in 2012, the World Health Assembly adopted a comprehensive plan on maternal, infant, and young children nutrition, setting 6 targets to reach by 2025. Reduce stunting in children under 5 by 40%, halve anemia in of reproductive age, cut low birth weight by 30%, prevent any rise of childhood overweight, with exclusive breastfeeding rate for the 6 first months of life to at least 50%, and reduce and maintain breasting in children under 5 to below 5%. Also, significant progress have been made, and some countries have shown impressive results. These targets remain very ambitious. Today, 45 million children are still suffering from wasting, and I can remember that 80 days ago, the Self-Employed Food Program explains that they are expected to have 70,000 children and 17,000 suffering of acute malnutrition in Gaza. 148 million children are stunted. The consequences are devastating. Malnutrition is linked to 45% of deaths in children under 5. I'm sure Lina Show will tell more about the targets and the global situation during our panel discussion. Earlier this year, in March 2025, the Nutrition for Growth Summit was held in Paris. 47 countries took more than 400 commitments, and donors pledged significant funding for the next 4 years. We will know about this with our colleague Afshan Khan in just a few seconds. And to finish, during the Geneva Nutrition Dialogues, the meeting held here in December, something I believe home, the strategic role of Geneva in advancing global advocacy in nutrition emerged. So by session here today, the aim is to further encourage Geneva as a driver force in promoting global nutrition solution and to help build the long-term momentum to meet the 2030 targets. We will start with the agenda we would like to propose you today. The agenda is divided in 4 main movements. First, we are going to hear about Afshan Khan, Global Coordinator of the Standing Up Nutrition Movement, Scaling Up, Nutrition Movement, in a conversation with Pratit Singh. She will share the outcome of the recent Nutrition for Growth Summit and her vision and the vision of the summit regarding the Geneva initiative. After that, David, the director of 4SD, will take the lead of a high-level discussion entitled Voice from the Field, Building on Success, Facing What's Next. Then we will hear about Francisco Blanca, currently professor at the Geneva University, on this famous Geneva Nutrition initiative, and we find a few comments and testimony from the floor. And finally, the Geneva Health Forum invites us for coffee and a networking to continue the discussions.